Okay, normally I wouldn't record a Zoom session, but Glynis did the right thing and asked for a Zoom session with plenty of time. It's just not, like, my email won't let me send her the link. So I'm going to go ahead and record this. And then if she gets the link and can join us, great. And if she can't, then I can send her the recorded link. Hopefully she can, because there's some group work I want to do, and you guys can do that through do that through Zoom as well. So, like I said, hopefully she can join us. Do you have your math worksheet that's due today? Awesome. Goodness. Yes, I didn't put a pen in my pocket today either, so I suppose it's just going to be one of those days, isn't it? Well, we were going to start with some group work, but since it's you and me, I'll start with the lecture, and then when others get here, then we'll move to the group work. I thought we'd start with the review of the drugs for the drug test for this week. Just because sometimes it helps to hear what they sound like. Mm-hmm. Okay. Diovan is valsartan. It's an antihypertensive. So I think I pointed this out last time that these Artans are usually antihypertensive. Okay, so they are for high blood pressure. Ventolin is an albuterol, so anything that ends in EROL is respiratory. And then what? Yep. Yeah, most of the time it's respiratory. So Diovan HCT is the valsartan hydrochlorothiazide. And usually the abbreviation for hydrochlorothiazide is HCTZ. Okay, so a lot of patients will call and say, I'm on that HC thing. It's the hydrochlorothiazide. Okay, and that's antihypertensive, but this, the Diovan HCT also is a diuretic. That's what the HCTZ is it helps them pee off. And remember that when we are controlling blood pressure, we can control it three ways, right? By volume, by resistance, and by the pumping action lever. Actose is not easy for me to say. Pioglitazone is for diabetes. Seroquel is quetiapine. Okay, that's an antipsychotic or a psychotropic. Levaquin. These oxacins, OXACIN, these are always antibiotics. Okay, but it's a specific type of antibiotic that we won't go into this mod, but you will in Pharm 209. We'll talk about the different types of antibiotics and how they work. But the oxacins are always antibiotics. Okay. Lantus is insulin for diabetes. Nasonex is mometasone. Remember last week we had the SONEs. I don't think I pointed it out, but those are typically a anti-inflammatory, similar to like cortisone. Okay, so it's a nasal steroid. And Viagra is sildenafil. You know what that's for, right? I think everybody on the world knows what Viagra is for impotence or erectile dysfunction. And Lyrica is pregabalin. And it's a neurological analgesic. So it calms the nerves so they don't fire as much. And so if we can keep the nerves calm and not firing off, then we don't have as much nerve pain. So this would be for neuropathy.
So this is for like pain or?
A lot of doctors also prescribe it for things like depression or fibromyalgia, but it is an analgesic. It is for pain, neurologic pain. Okay, and then there are other ways they found it works.
Would this work with, like, could you give it to somebody, would they be reason to give it to somebody with autism? Just because they're a little more strong?
Well, not so much because of the straddle reflex, but they tend to be very, I shouldn't say they, like all of them. Some people who are autistic tend to be very sensitive to sensations, like textures and touch and stuff, and this may decrease that sensitivity. So I know that there are kids who are autistic who can't wear socks because the seams in the socks cause them pain. This might help. Make sense? Mm-hmm. I have one of my former brother-in-laws, I swear was autistic. They never had him diagnosed, but he couldn't wear pants. He had to wear shorts all the time because he couldn't tolerate the feeling of the pants on his calves. So year-round, he was in shorts because he just couldn't handle that. Okay. Okay, so this is the group work we're going to do when everybody gets here, the worksheet. So I guess we're just going to jump into the lecture. Okay, so from the video last week, remember that there was not much in the way of regulation. We had the FDA, but they were really useless back in the day. So we had drugs that were completely unregulated. They didn't have to be proven safe. They didn't have to be proven effective. They were just drugs, and you could say, hey, this works, and people would buy it. And there was you didn't have to do anything about that, okay? So they didn't have to require proof they were safe or effective. Almost all of the drugs were elixirs and contained a high amount of alcohol. So, maybe they worked because of the amount of alcohol in them. I don't know. Drink enough, you don't care. And then some of them caused injury or death, which we know. Okay. In 1906, the Congress passed the first of a series of laws to regulate drugs, but after watching the Elixir of Death movie, we know that we had some laws, but they weren't very effective at all. So the Pure Food and Drug Act of 1906 prohibited the interstate transport or sale of adulterated and misbranded food, drink, and drugs. So adulterated is anything is added to it, like things that we know are dangerous. So any improper, inferior ingredients, it's not pure. So adulterated is really not pure. And misbranded is to label misleadingly or fraudulently, which is the only way they were able to get the Massengill company was on misbranding, because it said elixir and it wasn't an elixir. It didn't require drugs to be labeled, but if the drugs were labeled, they couldn't contain false information about the drug's strength and purity. Okay. This was unenforceable, and they had new legislation. So this is where we started the pre-approval of drugs by the government. So misbranding is when a product's label is incomplete, false, or misleading. It includes information that accompanies the product, such as advertisements. So not only could you not mislabel the bottle, but you couldn't have misleading advertisements. So mislabeling would be things like, or misbranding would be things like a label that doesn't give you warnings for use, directions for use or necessary warnings, doesn't contain precautionary label that fails to prominently display required information, a label that includes instructions related to dosage or frequency or manner of use that, if followed, would be dangerous to the user's health. That's why even if you pick up an OTC, like a Tylenol, and it will say things like, do not use more than this dose in a 24-hour period. Okay. Hi, Glennis.
Hi.
Are you driving?
No, but I'm in the car trying to get some strong Wi-Fi.
Oh, okay. Well, I'm recording this, so normally I wouldn't record a Zoom session, but since I was having trouble getting it set up, I'll record it and then I will send you the link to it so you can catch up on what you missed, okay?
So do I have to be connected right now, or can I just watch it all after class?
I would like you to, is there a way?
Because I'm sitting at a McDonald's parking lot using their Wi-Fi.
Okay. Which I totally appreciate the effort. But no,
Yeah.
I'll let you watch the recording. There is
Okay.
a group project that you're going to have to do by yourself, unfortunately.
Okay.
Okay? So
All right, that's
I'll
fine.
get this recorded and then I'll send it to you.
Okay, and I'll send you my math worksheet right now on an email.
Okay, perfect. Thank you.
Thank you.
Bye.
Bye.
Okay, so you're pretty confident in this labeling, right? I mean, the whole video did a good job of it. Adulterated, if it consists in whole or in part of any filthy, putrid, or decomposed substance. Anything that's not pure. I cannot even imagine what made them come up with filthy, putrid, or decomposed. I mean, what kind of drugs were they giving that had decomposed stuff in them? Right? It's disgusting. If it has been prepared, packaged, or held in sanitary conditions where it might have been contaminated with filth. So this sounds really disgusting, and it is. We had an outbreak of fungal meningitis not that long ago, and fungal meningitis is super rare. The doctors knew these patients had meningitis, but it wasn't viral and it wasn't bacterial. It turns out that they had been giving steroid injections, like into joints and stuff, but the steroid company had not been following clean practices, and fungus had gotten into it. And so the docs were giving these steroid injections, and then their patients were coming down with fungal meningitis, which is so rare it never crossed their mind that that's what was happening. But that would be an adulterated, and the drug company was held responsible for it, but ew. Okay. I think I pretty much covered that with that nasty steroid injection. You can look it up. It was about 4 or 5 years ago. the fungal meningitis outbreak. And it was because the manufacturing plant wasn't keeping up with what was a good, they weren't keeping their place clean. It was gross. Yeah, okay. So it's considered adulterated if there's any filthy, putrid, decomposed substance in it. If the place where it's manufactured is filthy. If the container itself is made up of anything poisonous or bad for you that can cause the contents to be harmful. So we know all those water bottles, and these are only like 5 years old, the BPA-free water bottles are new, but the old water bottles, they found leached that BPA into the water, and that was bad for us. So we can't store our medication in anything that's leached into the medication. And if you have coloring in it, you can't use red number 5 or whatever the red dye is that causes cancer. If they took out of the M&Ms, and you're way too young. You might be too. Red M&Ms in the 70s had their own flavor and they were so good, but they caused cancer, so we didn't have red M&Ms for many, many years. They were so tasty. I can still taste what a red M&M back then tasted like.
How come they're red now?
They just found a different dye that didn't cause cancer.
Oh, okay.
Yeah. It's also considered adulterated if the strength, quality, or purity differs from the original compendium or the original recipe. Actually, let's go ahead and watch this video. I've got the speaker hooked up, so let's see if it'll work through the speaker.
I didn't know that there was like prescription bottles for kids, and you can ask. Apparently, to the book saying you can ask for some that are not child-proof.
Oh, yes.
I didn't know that.
Huh. Look at that. The video's not working.
So that's what you want to turn around.
Right. So the reason that you can ask for bottles without childproof lids are for people with bad arthritis who can't work the childproof labels, or people who, not just arthritis, but who lack the coordination to do that. And most of the time now, at least the bottles I get, have the lids that you can do both, that you can just flip over so it's not childproof, or keep it childproof.
The only reason I thought they would use it is for the kids. I mean, I saw it in the new movie It. One of the kids was working on it, and he was just telling him, I was trying to get.
Oh, okay. Oh my gosh, yeah. What's his face's mom, who's completely crazy and afraid of, I can't imagine being that afraid of everything in my life that she was. Okay, so the Food and Drug Act of 1906 is the truth in labeling. Okay. If a label had any of the 10 dangerous ingredients, they had to be listed, but they could not list them if they were not present. So you couldn't say, oh, this has morphine in it if it did not actually have morphine in it. Okay. So if it was dangerous, it had to be listed. So alcohol, morphine, opium, and cannabis were all included on the list of dangerous drugs. It's estimated that the sale of patent medicines containing opiates decreased by 33% after labeling was mandated. So people were putting opiates and stuff and not saying it. So then once they had to start labeling it, it went down. So this is a prescription bottle of what used to, I mean, this was basically what it used to be. Here, have some, go to your local apothecary and get your laudanum or whatever, and here, take it till you want to.
With good happiness. With good happiness.
So these are all of the pieces that go on a prescription label. And you guys have all had a prescription at least once in your life, right? So they should look familiar. It's got the name of the drug, the dose, the strength, the form. So the simvastatin 40 milligram for Zocor. This one actually gives both the generic name and the brand name. Most of the time it's just the generic name on there. Gives us the form, who the manufacturer is, when it expires, who the doctor is, how many refills are left, the patient, the SIG, or the directions, and the pharmacy. So it's got everything on there that you expect to see on there. And if you've ever had a prescription, you probably are used to seeing this. The manufacturing label, though, we don't usually see. As patients, we don't usually see the manufacturing label. All we see is the prescription label that tells us how to take it, when to take it, who prescribed it, what it is. But the manufacturing label that they take all of these out of has to have the dispensing instructions, how it's stored, the lot number and expiration date, the legend statement. Okay, so that tells us what's in here. It gives us our controlled substances mark. So this is a class 2 drug, a giant C with the 2 in it. So we have class 1 through 4 drugs. Class 1 drugs are drugs that have no medicinal value and should never be prescribed. Those include things like PCP and LSD that we tested on people and realized they were maybe not the best drugs for people to have. And believe it or not, marijuana is considered a class 1 drug. And that's why it's federally illegal, even though we know it has medicinal value. The federal government says it doesn't. So class 2 drugs are the highest level we can prescribe. Okay, class 2 drugs have their own prescribing rules. And typically on here is the NDC number. Here it is. This is the National Drug Code number, and it is an identifier for the medication. It is, those of you who had billing with me, right? No, you didn't have it, but looking up the drug codes in the HCPCS books is a pain in the neck. What I would do, alternatively, is I would use the NDC code. That's the National Drug Code. I would use that number instead of looking up stuff in the HCPCS, because the HCPCS drug manual is a pain in the butt to use. So I would just use the NDC. So the package inset, have you guys ever seen one of these? They're really small. They're only about an inch when they're folded up. But then you unfold them and they're like a map. You ever seen one of those? Yeah. Okay.
Oh, like they're warnings and everything.
Yes. Yes, they're huge, right? That's the package inset that tells us the clinical pharmacology, indications for use, contraindications for use, the warnings, adverse reactions. It will give you the actual chemical makeup of the drug. There's even a diagram in there. It's got the brand name, generic name, and chemical name. And actually, if you give me a second, I'll go grab the physician's desk reference and you can see what's in a drug insert. Here's a PDR for each of you. Yes. So if you just open the PDR anywhere, you're going to land probably on a drug. And these PDRs are way out of date because now mostly they're found online. And do you both have spring charts on your computer?
Yeah.
I do. Okay. Through spring charts, you can sign up for Hippocrates, which is a great little thing. Oh, I don't have spring charts on my computer. Hippocrates is an online oh, I do have spring charts. Hippocrates is an online PDR sort of thing, which is super handy, and you can download the Hippocrates app after you sign up for an account. You can download it to your phone. Yes, I know. So run it for me, please. And the cool thing about Hippocrates is that you can put in multiple drugs to see if they interact with each other, which is super cool. So if you do have spring charts on your computer, you can go ahead and open it and I'll walk you through how to get Hippocrates. Crystal, if you don't have spring charts on your computer, I think we can just go to hippocrates.com. So, Seta, here's the symbol.
Right now?
No, it's not.
Mine's on 2%.
Oh, man. Okay, so somehow my computer quit sharing. There we go.
You don't have math homework.
Yes, I do want your math homework, please and thank you. Okay, so the Hippocrates thing is right here. So it's the little E. And you could probably look it up on your phones if you have your phones with you, if you go to the App Store, whichever kind of phone you have. If you go to the App Store, you can probably look up Hippocrates. It's E. Here, let me just click over to it. Yes, I know it's EPOCRATES.com. EPOCRATES.com. Hippocrates. I just want to go to Hippocrates. Add exception. Confirm it. Okay, so you can sign up for a free account. I don't remember what my sign-in is. Let me see. And the cool thing about this is it's like the PDR online. Let's see if that's me.
But this book doesn't tell you interact. It just tells you.
Well, that book you have to look up. I gave you the password. That book you have to look up every potential interaction. So you have to make your own little, I don't remember how to log into here. You have to write down every little contraindication for every drug, and then compare it to all of the others. Oh, I got in. Okay. So with Hippocrates, and like I said, this is free. You can find it on your phone in the App Store as well. Sign up for a free account as a student. And we can look up drugs. We can look up any interactions. So let's just say, which drugs am I on? And I know we're kind of going away from what's on the PowerPoint, but this is super handy. atenolol. So we'll add that, and we'll add levothyroxine. And so I've put the drugs in here that I take every day, and there are no interactions. Right? So this is handy if you have patients. So said you give me a drug, any drug. We'll just see what we can come up with. Okay, so I'll go with Levaquin and Yasmin. Caution advised. Okay, and I knew that they would come up with a caution because it's an antibiotic and an oral birth control pill. So we want to see what the heck is going on with that, and will it give it to me? Antibiotics may decrease hormonal contraceptive efficacy. Okay, so always, whenever you give a patient who's on birth control an antibiotic, you need to tell them to use other forms of birth control. Okay, so that's an easy way to check drug interactions, and like I said, you can do this from your phone. So yes. No, you just sign up for it as a student. So you guys could actually go, oh, no, you can't because your computer's updated.
There is areas in there that tell you
that you have to pay for, right. But for what we do for this class, it's fine. And the PDR books that you have, there is a section of pictures. And so what we used to have to do, when I worked in the ER, it's towards the front, and they're the glossy sheets. When I had somebody come into the ER, and people never know which drugs they're on. They just know that they take the pink one this day and the blue one that day or whatever. So they would come in and they would have like their pills in their pill minders, you know, the Monday, Tuesday, Wednesday, Thursday thing. And as the ER volunteer low rung on the ladder, it was my job to then take those pills and match them up to the pictures in the book so we could figure out what it was that they were taking. So this is really nice here because instead of having to match every single dang picture like I used to have to do, I can put in the shape. Let's say it's diamond shape and it's blue, and yes, it's scored. And what kind of coating does it have? We'll just say coated, we don't know. And then on each, as required by the FDA, each side of the pill has to have imprints on it. Let's see if it'll come up. I was trying to do Viagra, but I don't remember what the imprints are. So one of them would be like 50 milligrams. And since I don't know the imprint codes, it's not letting me look it up. So here's the Viagra that I was trying to look up, and it would probably, it'll tell us everything we need here that would be located in the PDR, and then the pill pictures. So
are these not listed in alphabetical order?
no.
That's
Right, they're listed by type, so drug class, so antihypertensives, things like that. Pfizer, that's what I was missing. VGR 50 would be a 50 milligram, and it's by Pfizer, so I didn't know the imprint codes on them. But every pill has to have imprints so that we can identify it. So Hippocrates is really a handy thing to have, especially to look for interactions and stuff, instead of having to look up in the PDR. And let's see if this shows.
You know, there was a girl who she was a medical assistant or a nurse, or I don't know what she was, but she was writing a whole bunch of prescriptions, sending them to different pharmacies and people's names, and then going and picking them up. And I was one of the people that she did it to. And I'm like, I have those medications, but I never filled them up, and I never gone to the doctor's office.
Right. Well, I hope she went to jail.
Well, I'm pretty sure she did, but it's, you know, like, look how many of those prescriptions she filled and none of us did.
Right, in other people's names. And then she probably paid cash for them so they wouldn't show up on the insurance.
Yeah.
So anyway, that's Hippocrates, and it's super helpful. I'm not going to log out because I couldn't remember how to get in. Okay, so. There we go. So the PDR was the gold standard. Now we can look it up on our phones and on our computers, and it's so much easier to get back to our PowerPoint. Okay, so the Food, Drug, Cosmetic Act of 1938 came because of the elixir sulfanilamide. Was it actually sulfa that killed the patients? No, it was the antifreeze. Well, it was the DEG, which is the cousin to antifreeze, that killed everybody. Okay, so because of that, that's where we got the FDC Act of 1938 that made it law that you have to prove that the drug is both effective and safe. Okay, we have to test it before we give it to humans. And like the scientists said in there, if they had just run a very simple test on rats, they would have known immediately that it would kill them. And it took how long for the rats to die? 4 to 9 days. That would have delayed going to the market by 4 to 9 days in the grand scheme of things, is that. And it would have kept them from even going out there. Yep, back to the drawing board, figure out how to dissolve it. So I would agree that the Food, Drug, Cosmetic Act is the most important piece of legislation. Since then, we've had to prove that drugs are safe and effective. Except in pharmacy, we can't say effective because that would be too easy. We have to talk about the drug's efficacy. I don't know why they don't say effective, but it's pharmacy, so we have to talk about drugs' efficacy. Okay. So the FTC Act of 1938 gave the FDA power to conduct inspections of manufacturing plants to ensure compliance, which is important. Okay. This also applied to interstate transactions, interstate and intrastate, so moving drugs between states and within a certain state. Okay. This required the manufacturers to file an NDA, a new drug application, before they can market it. There's actually several steps to it, and we'll go through that. There's the IND, the investigational new drug application, the NDA, the new drug application, and then there's a bunch of steps. Very few drugs that pharmaceutical companies apply for actually make it to market because they get weeded out in the testing process.
Do we have access to this, right?
Yeah, it's the PowerPoint on there for today. Okay, so the 1914 Harrison Act was an issue because of the addiction to opiates and cocaine. Okay, and we touched on the Harrison Act briefly in the Hooked video when we were talking about opiates. Okay, this requires that manufacturers, pharmacists, importers, physicians have to be licensed and they have to pay a tax. Okay. So there was a clause in it that said that a doctor could not prescribe opiates to an addict since addiction was not considered a disease. So they were arresting doctors for enabling the addicts. And I think they even showed that in the video about the doctors being arrested. Okay. What came about years later was the Controlled Substances Act of 1970, and that's what we're most familiar with when we talk about classes of drugs. We talk about the Controlled Substances Act, where there's class 1, 2, 3, 4. Okay. On any controlled substance, there is a warning label that says maybe habit forming. Okay, it has to be on the label itself, has to be in package inserts, and any other place where they list the ingredients. It has to have that warning on it. The Harrison Act caused law-abiding citizens to be law-abiding and criminalize those who weren't law-abiding, which is how it works with, well, everything, right? So when they had prohibition, when we completely outlawed booze, did it get rid of booze? No. Now we had moonshine and distilleries.
Bootlegging even more.
Right, now they made a lucrative business for bootleggers. So it was the beginning of the black market, the criminal black market for drugs. Because, well, it's illegal now, and now if I'm going to stick my neck out to sell it to you, I'm going to boost the price up, and it's one of those unintended consequences. Okay, the Durham-Humphrey Amendment of 1951 tells us which drugs require prescription by a licensed physician and requires one of the following legends. So legend drugs, write this down, legend drugs are prescription drugs. So you might see them used interchangeably.
What are they called? Legend?
Legend, L-E-G-E-N-D. Mm-hmm. So a legend drug is a drug that requires a prescription. If it is not a legend drug, it's over the counter. So legend drugs or prescription drugs have to have one of the following statements on it. Caution, federal law prohibits dispensing without prescription, or it needs to say prescription only. Okay, all prescription drugs must have this on there.
So how do prescription drugs become prescription drugs and then all of a sudden be over the counter?
That's a good question, and it's actually super easy. So after a drug goes through the approval process, so Advil, we all take Advil. We buy ibuprofen over the counter, right? It was a prescription drug up until the mid-'80s. What they found was that the margin of safety was wide enough that it's a safe enough drug that it can be given over the counter. So then they just applied to make it an over-the-counter drug. You can still get prescription ibuprofen. It's 800 milligrams instead of 200. But yeah, a lot of our over-the-counter drugs started out as prescription only. And then they found that they were so safe that we could allow the layperson to determine their own dosages. I mean, eating ibuprofen 4 times a day for months is going to give you gastric ulcers. That warning is clearly put on the bottle.
So I've seen them like I've seen them put it on the drug like that heartburn medication.
Nexium, that used to be prescription.
Now that's available, but now everybody has heartburn because they use it and they don't know how to cure it anymore.
Well, we never really treated heartburn. I mean, we should have, because heartburn is primarily caused by Helicobacter pylori, which is a bacterium. So we could treat it and cure it, but people just keep getting it. So most of the time, we just treat the symptoms of heartburn when we could actually cure it if we.
Like that bronchial mist, it used to be over the counter, and it was just in the bottles.
So it's still over the counter, but it's considered a behind the counter, over the counter drug. You don't need a prescription for it, but because of the active ingredient that has been used to make meth, you have to be over 18 and you have to buy it from a pharmacist. Does that make sense?
Mm-hmm.
So BTCs are a whole, behind the counter drugs, are a whole new, within the last 10 years, category of drugs. And we'll talk about them a little bit.
So the packets and the rest.
Yes. I mean, I went to get some Advil cold and sinus, which is my go-to drug for if I get sick. Advil cold and sinus is my baby. And I couldn't buy any because I went over there with money, but not my ID. Okay, look at me. I am clearly over 18 and I am buying one box, but I get it. It's just a CYA thing. So behind the counter drugs are a new type of drug. They're still legal they're still legal. They don't need a prescription, but there are limited amounts. So we'll go through that. Okay. So legend drugs are prescription drugs. Over the counter are non-prescription, and then a subset of over the counter are BTCs, behind the counter drugs. The Durham-Humphrey Amendment authorized verbal prescriptions. So the physician or the MA can call the pharmacy and give a verbal prescription. It doesn't have to be written out. They can give verbal prescriptions for all but class 2 drugs. Okay. And it authorized prescription refills. So you don't have to go back to the doc every single month unless you're on a specific medication. Accutane is a very dangerous drug, but a lot of people are on it for acne, and it kills your liver, which is why you have to go, if you want to continue on Accutane, you have to have your liver panel drawn every single month, and the physician has to go through additional training to be able to prescribe Accutane. And we'll talk about that. I think that's the very last slide of this slideshow. But like I said, the Durham-Humphrey Amendment authorized verbal prescriptions, prescription refills, and then distinguish between over-the-counter drugs and legend drugs.
So if marijuana is considered a class 1 drug and we just have a prescription for it, then how did it come up with recreational too?
That is,
Just because of the voters?
it is still federally illegal. The federal government could come in at any time and shut it all down. They have bigger fish to fry right now, but they could. They kind of left that loophole
Would they
open.
really do it because of the amount of money that the states are receiving from it?
Sure they could, because the federal government's not getting any of that money, right? It's not their money.
Yeah.
Now, if they were getting a piece of the pie, it might decrease a little bit, but yeah, since it is still federally illegal, they can come in and shut it down. Because what's the rule with pharmacy law? The strictest law is the one that is to be followed, right? And so the federal law is stricter than the state law.
So a lot of people are just gambling, people who own dispensary, if they were to come to shut it down.
Yeah, I hope they're putting their money away. Mhm.
Okay.
Yeah, it is. It's a calculated risk on their part. They are banking on the fact that the government is not going to care one way or the other.
Pharmacy law is the stricter rule.
The stricter law is the one in effect. So if the state law is stricter than federal, then you follow the state law. If the federal law is stricter than the state law, then you follow the federal law.
So that's kind of like,
Which is why all of the quote unquote doctors who prescribe medical marijuana are considered quacks.
okay.
Yes.
So if federal law, isn't that stricter than state law
Mm-hmm.
for marijuana?
Mm-hmm. We're just going ahead anyways because we want to and we're taking the risk. And we're banking on the fact that the federal government is not going to come in and shut it down. And in all honesty, the more states who pass medical marijuana acts, the less likely it is for federal government to come in and enforce it. If it was just one state, federal government would be like, yeah, we can shut this down right now. But now it's multiple states who have medical marijuana. And then legalizing marijuana recreationally is a whole different gamble, because the federal government can still come in and say, y'all are felons now because you're dealing in class 1 drugs.
So when, I mean, my perspective, I think that when it just, all the states legalized it and then the feds were like, oh, look at all that extra money, let's tap into that. I mean, I know about the prohibition.
I think that's the movement. I think that's the way things are going to end up going. I don't think we will ever get, especially after watching Hooked last week, I don't think the federal government will ever back off on marijuana being illegal, because they have invested too much time and money in fighting a weed.
But yet we give methadone to users and keep them hooked.
Right. So I don't see the federal government ever reversing their stance. What I see them doing is continuing to do what they are now by not enforcing it. They just kind of step back and look the other way. That's what I see them doing. I don't ever see them apologizing and saying, oh, we were wrong, there's hope. No. I just see them allowing the law to kind of go dormant. They'll just keep it in their back pocket in case we get out of hand, and then enforce it. Does that make sense?
Mm-hmm.
Okay. Because there are a lot of laws on the book that's happened to. I mean, is it here? Well, if you look at the laws that are on the books, there's a whole bunch of ridiculous laws that are still on the books. Like you can't, I think it's Colorado, where you can't ride your horse on a Sunday, something like that. They just let the law go dormant until they need it. So when I was working at the livery, we had a guy come up and go out on a ride. He passed out and fell off his horse. We thought he'd fallen off his horse and hit his head, but it turns out he was drunk. So it is animal cruelty to ride a horse drunk. It's illegal to ride a horse drunk. So they just keep those laws in their back pocket for when they need to use them. I know, it's crazy, isn't it?
And you charge for operating the horse.
Yep. Yep.
Just thinking about it.
That guy, we had to air life him out. So not only did he get charged for his helicopter ride and his hospital stay, he then got arrested for animal cruelty.
Oh, I can only see the charges. Animal cruelty, DWAI.
Right.
I mean,
They could, yeah, it was incredible. But people forget that at altitude, alcohol hits you faster. So he had a couple beers down in Boulder and then drove up with his family to go horseback riding. And a couple beers, I mean, it's roughly double at altitude. 1 beer equals 2 at altitude. So a couple in Boulder for a flatlander was already a lot. And then to drive up to 9,000 feet made his couple like half a 6-pack. So, okay, over-the-counter drugs. They do still have to be approved by the FDA, and the consumer can use it without a prescription from the physician. And there are over 100,000 over-the-counter drugs, okay? 80 different categories. They have to, the manufacturer has to follow the drug monograph. So their proper labeling must include the active ingredient, the directions for use, the amount of contents, the warnings, and the expiration date. Remember that over-the-counter drugs typically have started as prescription drugs, but we found that they're safe enough that we can use them, that we can trust that you just use them. Okay. So I can't really see that, but we've all taken over-the-counter drugs, right? So we're familiar with the ask your doctor if you have this, or if you are pregnant, or when you use this product, do this, and then it's got all the directions on it. We've all used over-the-counter drugs? Familiar with the label? Okay. The BTC drugs are the behind-the-counter ones. They're sold without a prescription, but they have restrictions on the amount you can buy. Thank you to crackheads, right? They're kept behind the pharmacy counter. And the examples here are the pseudoephedrine and the ephedrine, because that's it's a stimulant. Okay. The limitation is 3.6 grams per day or 7.5 grams per month. So most of these, and remember that if this was in milligrams, it'd be 3,600 milligrams or 7,500 milligrams. So this doesn't look like a lot. The 3.6 doesn't look like a lot of drug, but it actually is, because we prescribe these in milligrams, not grams. Okay. So the reason we have this is to combat the Methamphetamine Epidemic Act. Requires cold and allergy medication to be kept behind the counter. We have the daily and monthly restrictions. And then the sales record has to be kept for 2 years. The record needs the drug name, the quantity, the name and address of the purchaser, the date and time of the sale, proof of ID, and the signature of the purchaser, which is why you have to have your driver's license to go get my favorite Advil cold and sinus.
So that, like right now, I've been battling cold. I like the Advil or the Aleve cold and sinus.
Mm-hmm.
I can only get like a couple of boxes a month. What if I'm battling this cold for 2 months?
Right.
I mean, I don't like this stuff, so I don't take it very often.
But yeah, there is a limit on what you can buy per month. So you have to be 18 years or older. And yes, ma'am.
So I know people have been putting like cough syrup or medicine, but I think you can buy it like over the counter. They've been making, they call them, is that?
It's because it's got the
Is it in there?
the stimulant component, probably dexamethasone, probably DX is in there, but I'm not sure. Yeah, people do some weird stuff. But yeah, that's a BTC. Most cough syrups that have a stimulant in them are behind the counter. You can get some over the counter, but for the most part, the good cough syrups that are actually effective are behind the counter drugs. Isn't that nuts? Okay, let's go ahead and take a break. We'll be back at 9:41. And Glennis, I'm going to go ahead and pause this, maybe. I'm going to pause the recording, and then I'll start it back up after the break. Maybe. If I can get the stupid thing to work. Okay. So we talked about the Combat Methamphetamine Act, which really made it difficult for all of us law-abiding citizens to treat our colds and coughs, right? The Kefauver-Harris Amendment of 1962. In 1962, we had a new drug called thalidomide. It caused severe birth defects when used during pregnancy. If you remember from the elixir epidemic or the elixir video, the scientist who talked about how easily the sulfanilamide could have been tested on rats, she was the same scientist who blocked thalidomide from being sold in the US. Okay, and she did us a huge favor because seriously severe birth defects were happening in Europe for parents who were using thalidomide.
What's the name? Kefauver-Harris?
Kefauver-Harris. Always sounds like fava beans and Chianti from.
That's my last name.
Yes. So this extended the FTC Act that says not only do they have to be safe, but they have to be effective. They have to work. Okay, so we talked about efficacy. This requires drug manufacturers to file the INDA, the Investigational New Drug Application, before you can start the clinical trials in humans. And then once it has been proven to not make you grow 3 heads or cause cancer, then you could submit an NDA, the new drug application. Okay. So this is crazy. I know a lot of people complain about the cost of drugs, and even I complain about the cost of drugs, but the pharmaceutical companies spend 1/6 of their income on research and development. Of those drugs that they are researching and developing, a small piece of them make it to market. So I understand why drugs cost so much when they first come to market. They are trying to recoup all of that money that they put into researching the drug before their patent runs out. And once the patent runs out, then bless you, other people can market it and they can sell it as a generic.
Thank you.
So I completely understand why. That doesn't mean I like the high prices, but I understand where it comes from. You know what I mean? So it is a very long and difficult process. They try thousands of chemicals, and then they have to pay for all the clinical trials. And we're talking 10 to 12 years for a drug to get to market. Now, there are a lot of people out there who hate big pharma, who hate the pharmaceutical houses, and will say the cure for cancer is just languishing. They're just trying to make money and blah, blah. The cure for cancer may actually be in the approval process. We don't know, but I don't want to short circuit that, right? Because what if the cure is worse than the disease? Right? We don't know until we've thoroughly tested it. Having said that, there are some drugs that have been fast-tracked, and I couldn't name them off the top of my head, but I know some of the HIV drugs were fast-tracked to market. Okay, and people were taking it knowing that they hadn't been fully tested.
Wasn't some of the HIV drugs bleach? Or is that just a myth?
I think that's just an urban legend. Yeah. We know that bleach kills the virus, but we also know that it's dangerous to ingest.
Right.
So I'm going to go with it's an urban legend. Okay. The drugs have to go through an extensive training and approval process to prove safe and effective. Okay. It typically takes more than 10 years, and a patent is only good for a small period of time. Okay. Yes.
So with that, I heard about some douchebag guy who bought something. It was like a pill or something, and just made it so expensive.
Yeah, he should be drawn and quartered.
What's that deal? Why? When does he have a patent? Is it on that eventually?
No, he was just being an ass.
So
I'm sorry, I shouldn't have said that, but he saw potential to make money and took it.
So it was a drug before he bought it from somebody.
Yes.
And
The HIV drug, is that the one you're talking about, the HIV drug?
I don't know.
And then the EpiPen. So there were 2 cases within months of each other. So an HIV drug they like quadrupled the price of it. And EpiPens have been on the market for decades. And they were never cheap to begin with, but then they jumped them up to over $300 per pen. Now, this is a drug, it's not new. There's nothing, I mean, we've had EpiPens for decades. If anything, it should be $5.
Aren't they being charged for something?
I don't know, well, I don't know the particulars of the case. I don't know that there's anything the FDA can charge them with, but I think there are other agencies that can charge them with something. I don't know, because like I said, I don't know the particular. I think they should have had an accident and died in a gruesome manner. And I just recorded that. Shh, don't share that with anybody.
So the patent, there's no patent on that. What keeps other people from making their
Nothing, actually. There are generics available. It's just nobody ever pursued the generic for the EpiPen until this happened. So we may find, if we follow the money, we may find that the guy jacked up the prices because he owned stock in the generic and wanted people to move to the generic. I don't know. But yeah, the patent is long gone on those, and it's, you can buy it in a generic form. Just nobody, there was really no money to be made in it. So nobody really produced a generic form of it. So, all right, so here is how the drug approval process works. And we'll go through this a little bit more in depth, but I like flow charts. So it takes 2 to 10 years to discover the drug, okay? Then you have to do all of your preclinical research. So you have to come up with the idea for the drug. Then you have to research the drug, which includes making it first, the initial synthesis, doing the laboratory and animal testing, and then reviewing it. That takes 3 to 6 more years. And then they have to submit their IND, which is their investigational new drug application. Once the IND is approved, then they can start clinical human trials. And we've got different phases of those human trials. Okay. And I know a lot of people are against testing on animals, but the alternative is to test on humans. I want to make sure that we run the test on the rats or the monkeys or whatever before I give it to a human. There are some computer modeling things that you can use, but I'm not quite sure that those are. The computer modeling is great in one aspect because you're not testing on animals, but it also can't take into account all of the different variations that occur in animals or in humans, because we're not all exactly the same. Our basic biology is the same, but everybody's metabolism is slightly different. So after we submit the IND, then we go to clinical trials. Phase 1 is testing in healthy subjects. Phase 2, so when we are testing in healthy subjects, we're testing for safety, making sure that it doesn't cause any weird reactions. Phase 2 is testing in individuals with that specific disease. So phase 2 is all about the efficacy testing. Is it effective? And then phase 3 is large-scale testing in individuals with the disease. So phase 2 may be a few hundred people, whereas in one state, whereas phase 3 could be a few thousand people nationwide. That makes sense? So do either of you read Stephen King, or have you ever watched Firestarter? So Charlie, the little girl in Firestarter, got her powers because both of her parents were involved in phase 1 testing of a drug like LSD. So it altered their genes so that when they had a baby, she got whatever genes that were altered, and that's where she got her telekinesis from. Just like, if you've watched Stranger Things, they explain that in the 2nd season of Stranger Things. That's where Eleven got her abilities, was from phase 1 clinical trials of mind control drugs. Yeah, interesting. Little bit of science fiction for you. After they have done the clinical trials, then they submit their NDA, which is their new drug application. The FDA reviews the new drug application, reviews all of the data that comes with it. So the FDA looks at it, says, we might have some concerns about here. It returns their concerns to the manufacturer. The manufacturer answers it, comes back. This can take 1 year to 2 years for it to be approved. After it's approved, then it can go to market, okay? So the clinical testing doesn't end with phase 3. I mean, I suppose the testing phase does, but after it goes to market, they do what's called a post-market surveillance. And once it's in market, we watch to make sure that it continues to be safe. Now, there are some drugs that looked safe in their clinical trials, but are now out on market, and we know that, oh, maybe they're not so safe. And that's when we end up with recalls. So there was a drug on the market briefly. It hit the market at the same time as Celebrex did, and I believe it was Vioxx. It was a COX-2 inhibitor, just like Celebrex, but there was a compound in Vioxx that caused, if you had an underlying cardiac issue, it exacerbated that issue. It went through all the phase 3 clinical trials without a problem, but once it went to market, then we saw people with cardiac issues showing up. So there was a voluntary recall on the Vioxx. Okay. Ambien. You guys have heard of the Ambien murders? Well, you haven't heard about those? So Ambien went to market, went through all the clinical trials. It's still available. You can still get it. But there have been a handful of cases where the people who are on Ambien long-term start sleepwalking, and a couple of people have murdered other people in their sleep and have zero recollection of it.
Oh, wow.
Yeah, it's one of the weird, and it's only happened to a couple of people, but yeah, it's one of the weird side effects of Ambien. So I think they shortened the amount of time you can be on it. It can't be a long-term thing. But we would not have known that from clinical trials. They did clinical trials on thousands of people and it never showed up. It wasn't until we started seeing hundreds of thousands or millions of people use it that those weird side effects show up.
It's just like antidepressant though and psychotropic drugs. You know, they clearly have stated on the bottle may cause suicidal tendencies. Well, hello, it's why I'm taking it.
Right. So what happens with the SSRIs, the selective serotonin reuptake inhibitors, is that your serotonin's out of balance, right? So our brain, and we get into this more in Med 209, but our serotonin's out of balance, so we stop the body from taking up the serotonin so that there's more floating around in the synaptic spaces. And there's a one point, it's about 14 days, 10 to 14 days after you start taking the SSRI, that there's about a 24-hour period where your body finally comes into balance. And it's like that last, you know, on a teeter-totter, how there's that moment of pause before you go up or down if you're balanced just right. Yeah, that's kind of what the SSRIs are doing, is it's about 10 to 14 days after you start taking it, where some people, not a ton of them, but a fair number of people get suicidal right before that balance tips. And it usually lasts 24 to 48 hours, and then it's done. But it's that pause as they come into balance. And yeah, we didn't talk much about it. Now, anytime I know somebody's on an SSRI, I warn them. You're going to have a rough 24 to 48 hour period. But if you can get through that 24 to 48 hour period, usually it's okay. Some people never get past that, but the vast majority of people feel really, really bad for a day or two and just in the worst depressive funk they've ever been in, and then they come out on the other side okay.
How many days after you're taking it?
10 to 14, usually. That's what we've seen, and that's when they say it may increase suicidal ideology, that's what they're talking about, is that period of time where the body is just still fighting to stay at where it's used to staying, and before it clicks over. And that's when it gets really dangerous for people to stop. A lot of people go, oh my God, this drug has made me worse, and they quit taking it. And now their serotonin plummets again, and it tends to plummet worse than it was before. So it's one of those things that the docs need to be aware of and need to support their patients through that time period. And if the patient decides, I can't do this, then we need to back them off slowly so that we don't have that huge crash. It's crazy though, isn't it? How that works. Okay. So we've already done that. So we've already seen the FDA approval. Okay. I personally, after having watched Elixir of Death multiple times, I mean, I've been watching that for 10 years, I am all about the drug approval process. All about it. Okay. So from the year 2000 to June of 2008, the different types of NDA approvals, we had new combinations of drugs. So new combinations would be drugs that we know are effective independently, but let's put them together and see how effective they are. Okay, new manufacturer or new indication. Hey, we have this drug. What is the drug? There is an antidepressant that is really good for smoking cessation.
Chantix?
Yes, Chantix was meant for depression. Turns out it's really good for smoking
Wellbutrin.
cessation. Yes, and Wellbutrin as well. So that would be a new indication. The drug has been approved, but let's study this new indication. And now can we prescribe for that?
I have tried the Wellbutrin, and I don't see how it helped. I mean, and I stayed on it for like 2 months.
Some people do really well on Wellbutrin, some people don't. Was it for smoking cessation? Yeah, some people respond, some people don't. And that's, same with some of the weight loss drugs.
Yeah.
So yeah, that would be a new indication approval, was 8%. It's already a drug, it's on the market, and oh look, we found that it also works for this. Let's get it approved for that.
So the nicotine patches, how can those be an over-the-counter drug when people can get nicotine poisoning for too much?
Because they're taking the consumer's taking the responsibility of when they purchase it.
Mm-hmm.
It says clearly on the box, do not use more than this amount throughout the day or whatever. And so the warning is clearly posted on there. If they don't follow the directions, that's on them.
So I want to go back to homeopathic, if you don't mind.
Okay.
How do they get around being able to market and all of that without the FDA involved?
Because they're not actual drugs.
Okay.
Does that make sense?
Yeah.
They cannot claim, and the biggest thing for the naturopath stuff is they cannot claim it as a treatment. They can suggest something that you can try this. Yeah, you can try this for relief of symptoms, but they cannot say it will cure. And if you ever run across a homeopath who says it will cure, they are in huge violation. Okay. So 1% was over-the-counter switch. So you have to put in an application saying that, hey, this has been out to market for so long, and we've had no problems with it. Can we take it OTC? Claritin, Clarinex, all of the allergy meds, those were all, and it wasn't that long ago, 10 years ago, they were all prescription. And now you can just go buy them. Okay. It's amazing how fast things can go OTC if they're safe. So the NDA, all drugs, either domestic or imported, require FDA approval before they can be marketed in the US. A lot of people would just buy their drugs from Canada or Mexico. Not technically legal. Why would it not be technically legal to buy, for a consumer to go to Canada to buy their drugs?
Maybe crossing the border with different.
The other country's
Yep.
regulations.
Yes, the other countries' regulations may not be as strict as ours. They might be, they might not be, but they're not under FDA control. So yes, now crossing the border with things that could be controlled substances, now that becomes an issue. So yeah, there's a couple of things. Now I know my friend Andrea, she lives down on the border of Mexico. Her asthma medications are super expensive. So she just crosses into Mexico and buys the generic and saves herself, $300 a month. But that's a risk she's willing to take, because really, it's not like she's going across and getting controlled substances. She's going across and getting Advair. Who's going to stop her for Advair?
Yeah.
We talked about safe and effective. So the first clinical trials prove safety. The second and third clinical trials show efficacy. The drug manufacturers themselves are the ones who bear the burden of proof for safety and efficacy. The FDA just oversees everything. They review all of the data, but they're not the ones responsible for what the drug company reports. So could potentially the drug company submit cooked books? Could they completely? They could, but I'm not seeing, there's such a huge liability involved. I don't know that that would be a smart move on their part.
So like that IUD, you know, it came out as what, I think Yaz or
Yes, was oral, but
I don't know, it came out as one thing and then it was recalled and now it came out as another thing, but it's the exact same thing.
they had to have done, it can't be the exact same thing. They had to have done some tweaking with probably the hormones or even the IUD itself. If the shape of the IUD was a problem or if it wouldn't stay in, they had to have tweaked it and released it. Because they can't release the exact same thing if it's been recalled. They have to fix what caused the recall. So we're looking at, from beginning to end, discovery can take 2 to 10 years. Then you've got the preclinical testing, the laboratory and animal testing, and we've got the phase 1 testing, which is a handful of healthy volunteers. Phase 2, a couple hundred patient volunteers. And then phase 3, a few thousand patient volunteers. Then you have to go through the FDA approval process. Takes about 17 years from very beginning to end. Now you can, most patents, I believe, I don't want to speak out of turn, patents are good for, I want to say 12 or 20 years, and I don't remember off the top of my head. But if the approval takes longer than it should, and you can't get the drug to market before the patent runs out, you can apply for a patent extension. Okay, which allows you to recoup some of that money before it goes generic. Now, for me, and I don't know if pharmaceutical houses have done this, although I'm sure they have, if it were me, not only would I hold the patent, but I would be the first to market with the generic when the patent ran out. I would sell, if I were the pharmaceutical house, I would sell both the brand name and the generic. That's what I would do, just to continue to have money. Because once it goes generic, you lose money. So I would make sure that I produced both. So we have to test on a double-blind clinical trial. Have you heard of those double-blind clinical trials? So patients are divided into categories that nobody knows. So the people doing the testing don't know if the patient is on a placebo or on an effective drug. Are they?
Yeah. I mean, I don't do it just because they get a $300, voucher for their vet fees, but Nicholas, my older dog, was not arthritis. She's in a lot of pain. The medication was very expensive, and that was one way that I could keep her comfortable.
Yeah.
You could tell if she got a placebo. She was hurt. And I would let them know, no, this is not working. I need something else for her.
Right.
And then if it wasn't working, they take her off right away and give her back her medications. But the last drug she had gave her a tumor on her spleen. So the drug company paid for the surgery to have her tumor removed. And they said she'd only live 6 weeks. She lived almost a year and a half.
Wow.
And when she passed away, they paid for to put her down. They paid for her cremation and for me to get her ashes back.
That's actually very nice. And so you can, as a human, sign up for those drug trials. Now here in Fort Collins, I think it'd be harder to find, but I know if you live in the Denver area because of UC Health, there's always research going on. And you can, if you live near a medical school, you can always look for drug trials to earn a little extra money. Then you might end up with a fire starter kid or 11. I don't know. So I'm not sure I would do it.
Well, she's a pit bull, and they say pit bulls are 12 to 15 years, and she's 17.
Oh, so that's awesome. That's awesome. Okay, so the placebo is an inactive substance. There's no medication of any kind in it. So when they do these studies, the patient can't know if they're getting a placebo or not. And one of the things that they report out, if you look in the PDRs that you have, there will be a placebo report. People who are taking the drug who think it's an active drug and feel better because of the placebo. And that was in IT. You were talking about that this morning. In IT, she was giving him placebos to make him feel better, but it was really making her feel better, right? So that's part of the clinical testing. We've got the INDA, we've talked about that, the investigational new drug, and the NDA, which we've done. The testing phases before we even get to the human, we start on animal, which are preclinical testing. We treat them as they're bred, these animals are bred for this. We treat them as humanely as possible, of course. We're not torturing animals, but if it comes to giving a rat a test drug or my child a test drug, I'll buy all the rats you want. Okay. Have you ever read the book Flowers for Algernon? No? Oh, such a great book. But it's about the preclinical testing. And they gave these rats, Algernon, who is the rat, they give him these drugs and it increases his intelligence. So then they move into the clinical trials. And this was written back when we used to use, and we don't do it anymore, but we used to use institutionalized people for testing.
Oh.
Yeah. Have you ever seen or even heard of the movie Clockwork Orange? Yeah. We used institutionalized people. I've never seen the movie. I read the book, or I read a summary of it. I think I read the book. But we used anybody who was institutionalized for mental retardation. We used to do testing on them. Thank God we don't do that anymore. But in the book Flowers for Algernon, the test went so well on the rats that they gave it to this gentleman whose IQ was like 40 or 50. And then he got smarter than his researchers. It's an excellent book. It'll make you cry. But it's all about these testing phases of the NDA as well. So only a fraction of the drugs that we test on animals ever get to clinical trials. They determine that they're not safe, they're not effective, they're not going to work before we ever test them on humans, which I think is a good use of animals. I tend to be kind of pragmatic when it comes to animals. Clinical trials with humans, we have to have informed consent, which is why we can't use institutionalized people anymore. They are not mentally competent. They can't understand the consent. Bless you. So, you know, that's an important thing. Yes?
What I'm thinking is like, I had this question, I thought about it, and I was talking with my brother. I was like, well, Alzheimer's and dementia, you know, how could they study that?
So we can't study on anybody who is not mentally competent unless we get permission from somebody who has power of attorney. So a guardian for them can sign for the tests.
Where does that line?
You know, I don't know. And I'm glad I'm not the one to come up with that. That has to be between the patient and their physician and their family. Yeah, that's a hard one.
Yeah, that's what I was thinking.
Oof. You know, medical ethics fascinates me, but I am so glad I'm not the one who has to make those decisions because, yeah, especially somebody like with sundowners, they have moments of clarity and then they've got moments where they don't. And with Alzheimer's, maybe if you can identify it early and while the patients are still with it enough that they can give consent for the trial. I mean, if I was diagnosed with Alzheimer's and I knew I had Alzheimer's, I would be like, yes, get me in the trial. But if I'm too far gone, then it has to go to somebody who has power of attorney. Yeah, that's a tough one. It's a really tough one. For somebody else?
Yeah. I mean, like if I was my husband's power of attorney and he had Alzheimer's, I mean, if I would do anything I could possibly to save his life, so, you know, I might do it. But knowing of the possible side effects, I don't know put him through that.
Right. I have to tell you, I'm so glad my children made it out of childhood without getting cancer, because I don't know that I could put my child through chemotherapy. I have a friend who went through chemotherapy, and it was, I've talked to his mom, and, he's doing great. He's married, has 2 kids. They thought, I went on his Make-A-Wish trip with him. So he was terminal at one point. You don't get Make-A-Wish trips just because you're cute. You get Make-A-Wish trips because you've got 6 months to live, right? So talking to his mom, though, about chemo, I don't know that I could have put my kids through that. I don't know. But then look at the outcome of it. He's in remission. He's got kids of his own. He's married,
But going through chemo, I don't think I could have done it if it wasn't for my parents right there and helping me.
Right. So how do you make that decision?
Yeah.
As a parent, how do you it's a hard enough decision to make as an adult. I don't know. I'm just so thankful my kids got through childhood without cancer, so I didn't ever have to face that choice, because
I
It's
didn't
so
want
tough.
it, but my daughter begged.
mm-hmm. Mm-hmm.
She said, "Let me just do the surgery." She said, "No, please." It's fine. So I did it.
Right.
I'm here. I'm
And
grateful.
yeah, you came out on the other side, but I know it's a tough process to get to the other
I
side.
didn't want to do it. I refused to, because you know how many people I've seen die?
Mm-hmm.
You know, and I'm not an athlete anymore, I'm kind of old and fat and lazy, but was very outgoing and athletic, and I didn't want to lose those abilities, and that was one reason why I didn't do it the first time around. I got cancer the second time around, and my family said, "You are doing this."
Right. Right. Which is a good thing, but it's.
I hated that in the beginning
Mm-hmm.
because I was in pain. But once again, if it wasn't my family right there taking care of me and helping me through it, I don't know what I would have done.
Right. Right. It's a tough decision. I'm just super glad that my kids got out of childhood, and now it's a decision that they can make. And I will support no matter what. I would support them. But oof, it's a tough decision to make. So clinical trials require informed consent. It requires that the patients be told of all the risks and benefits or other treatment options in a language they understand, which means not medical terminology, not hiding behind chemical names and stuff, none of that. And the patient should be free to leave the trial at any time. Okay, so if it's supposed to be a 3-month trial and they get so sick after 2 doses, they can leave. You better collect that data, and then they're done. Okay.
But then on a lot of those clinical trials, they pay, so the people don't want to leave because
Right.
they're going to get paid.
There was, I don't even know if the TV show's on anymore, but the Extreme Cheapskate TV show.
Oh, that's okay. Oh, I did.
There was a guy who did nothing but clinical trials. That's how he made his money. He sold his testicle for $30,000 for research. Yeah. He's like, well, they paid for the surgery. They gave me a prosthetic. And they took my testicle, and I got like $30,000 or $35,000 for it, for research and testing. But that's how he has no insurance. He has no doctor. That's how he gets all of his care, is by volunteering at the medical school and volunteering for clinical trials. And so he takes this big stack of stuff with him to all of his appointments.
Does that bother, like, the creation scene? Like, would you have enough, I don't know.
So-
Say it wrong. The-
So could they father children with one testicle?
Yeah, is it possible?
It is possible. It's just lower. Yeah. So a lot of times if somebody has testicular cancer, before they do the orchiectomy, they may have them bank their sperm. So it ups the chance of them being able to have kids later. But if you just have one testicle, yes, you can still father children. It's just more difficult to do.
Is it more difficult where they just don't have it, like it's not creating it sometimes not?
No, they
it's
still-
not creating that.
The semen is still, the volume of semen is still the same. It's just the sperm in the semen is half. So yeah, that's why they have them bank their sperm if they can. I think we've talked about phase 1 and phase 2 a lot, right? The important thing I want to talk about this phase 1 clinical trial is only about a quarter of the drugs that we test in phase 1 ever go any further. So if there's 100 drugs in phase 1 testing, only 25 of them will go to phase 2 testing. So there's a lot of testing going on out there that is not, that doesn't move forward. So phase 1 is for safety, phase 2 is efficacy. Well, safety and efficacy, it's adding up. Okay. And then phase 3 is when we have thousands of people on it. We're trying to figure out with phase 3, we're also trying to figure out the dosage. So we know it's safe and effective, but we can't come up with an adequate dosage with only 300 people. We need thousands of people to see what the effective dose is and the range of the effective doses. And then phase 4 is after the drug has been approved. That's that post-market survey. So if you take a medication, you are part of the phase 4. We don't really call it the phase 4 trials, but you are. It's the post-market survey. So if you have any side effects, then it should be reported.
And how long are those post?
Forever. As long as the drug is on the market, the post-market surveys go forever. Because it may be 10 years before we find, I mean, a drug could be on the market. It could be super, super safe. Depo-Provera. I love Depo. I was on it for years. But what they found is if somebody's on it for more than 10 years, that increases their risk of osteoporosis. We wouldn't have known that from the clinical trials. It wasn't until post-market surveys, and then they saw, oh, wait, these women are getting osteoporosis. What's the thing? Oh, look, they're all on Depo, and they've all been on Depo for 10 years. And so we would never know it if we weren't doing the post-market surveys. So as long as the drug is on the market, surveys are occurring. Okay. So there are some, in clinical trials, there are some special treatment status. Okay. We did this with AZT for AIDS. So you got permission to give the drugs outside of the clinical trials because there was no other option. We had no other drugs for AIDS. So they got a special treatment status that, okay, we're going to give you this because we're trying to save your life and we have no other options. Okay.
So it's, you're going to die anyways, let's try this?
Yes, kind of. I mean, that boils it down to the bone, but yeah, basically, what's it going to hurt to try this drug? And it turns out AZT, miracle drug for AIDS patients, for HIV patients. Okay, maybe not so good. Once you have full-blown AIDS, then it's all symptomatic care. But turns out AZT is pretty good for HIV patients to keep them from developing AIDS so early. Okay. Magic Johnson? Holy cow, yeah. Boy, that man had one foot in the grave, didn't he? Controlled trials. We talked about the double-blind trials. One group of patients is given a control drug or the placebo, and one person's given the active drug, and we see how that works. Okay. The blind trials means that the doctor and the patient don't know who's getting what. So the patient doesn't know if they're getting a placebo, and the doctor doesn't know if they're getting a placebo. The only people who know are the people in the lab who are assigning the numbers, and it's all encrypted and stuff. Okay.
What's the difference between controlled and blind?
Typically, we run them together, not separate. So the controlled trial is a group of patients who are given a placebo, and we know who's in the control group and who's in the treatment group. Okay.
The doctors do.
The doctors do. The patients don't, but the doctors do. With the blind trial, nobody knows except the people in the lab dispensing them. So the doc doesn't know, nor the patient knows. So typically it is, they will run a control to look for placebo effects where the doc may know, but the patient doesn't. Initially, they might run that, but then they're going to run a double-blind study where nobody knows except the people in the lab. Okay, and they call it double-blind because the patient is blind and the doctor's blind. They don't know what they're giving. Okay, 17 years. I said 12 to 20. A patent is good for 17, and 17 is somewhere between 12 and 20, right? So the patent is the right given to a manufacturer to exclusively market that product for a specific period of time under a brand name. Okay. So the patent is good for 17 years. If it takes 15 years for you to get your drug to market, you only have 2 years left to recoup all of your money. Okay. So we have the Hatch-Waxman Act, which I mentioned, gives you up to 5 more years, okay, to make up for the lost time in research. Okay. While the drug is under patent, a generic cannot be sold. And there's a race to get drugs to market, to get the brand name out there, so that's what people always think of. So Advil is Advil. Even if we mean ibuprofen, we say Advil because that was the first ibuprofen brand to market. Does that make sense?
How, you know how you said you would make the regular drug and then you would start making the generic drug? Could somebody make another generic drug just like yours?
Absolutely. Once the patent is up, yep, it's free game. Which is why if I were the pharmaceutical house, I would have my generic ready to go to market the day my patent expired.
So
because the others are going to have to play catch up.
Could you get a patent for your generic?
No. Nope. You could only patent the brand. But yeah, if I were running the pharmaceutical houses, that's what I would do. Okay. So medical devices, biological products such as insulin and vaccines also have to meet the FDA testing and approval requirements, which makes sense. The biological products like vaccines we get, but medical devices, what kind of medical devices are we talking about? Yeah, they have to be safe and effective. Okay, think of the old school wheelchairs. I know you've probably seen them in movies. They're like wicker chairs with little wheels on them about this big, right? Those are not safe nor effective, right? You can get from point A to point B as long as the ground is perfectly smooth and you never hit a rock or go over anything, right? So we have to make sure that all of our medical devices are also safe and effective, okay? So we have the Center for Devices and Radiological Health is responsible for devices, and the name Radiological Health also implies that it's responsible for like nuclear medicine and x-ray machines and things like that. Yeah, it was there, right? And then the Center for Biologics Evaluation and Research is responsible for biological products made from living organisms, which would be vaccines. Okay, so we have 2 different oversights. And the Poison Prevention Act of 1970 came after, was this the one after Tylenol?
After their patent.
Yeah, I couldn't remember if this was, because there was a, I think it was the Tylenol. 7 people died from Tylenol that was poisoned. And that's why we would you ever take a drug, just because we've been born after 1970, if you went to the store and you bought a drug and it didn't have a safety seal on it, and it didn't have that inner cotton, and it didn't have that aluminum seal, would you ever take it? No, because that's just how, I mean, that's how we grew up with over-the-counter drugs, right? And that all became around because of the Poison Prevention Packaging Act.
So what, were people just opening the drugs and poisoning them, or?
Mm-hmm. The guy who did the Tylenol, yeah, he was putting poison in the Tylenol, but we didn't have locking lids, we didn't have safety seals, we didn't have any of that. So he could just dump the poison in there. And it seems so weird to me to think about that. mean, to get through to your medication is not easy. But that's because we grew up with it. In the past, you could just open the bottle. Okay. I don't remember if this is the Tylenol one or if the Tylenol one came later in the 70s. It's all around the same time. But we passed it to prevent accidental childhood poisoning so that the kids can't get into the drugs. Okay. Requires most over-the-counter and legend drugs to be child resistant. Holy cow, have you ever seen a kid get into meds? There's no child resistant about it. I mean, if I can't get into it, a 5-year-old certainly can. I don't know how they do it. They're supposed to not be able to be opened by 80% of the children under 5, and can be opened by 90% of the adults. Okay. Older patients with disabilities or arthritis can request a non-child resistant container. We already talked about this. Most things that you get now from the pharmacy have the child resistant one and the other one that you can just flip over. So you can just screw the lid on if you don't have children in the house, or if you do have young children in the house, you can use the child resistant lock on them. Okay, there are definite exceptions. Nitroglycerin is one of those. We do not want to delay somebody getting into their nitro if they're having a heart attack. So that's the last thing we want to worry about. And you just have to be very careful to keep nitro out of the hands of children. Okay. Eye drops, ear drops, and unit dose packages are like the blister packs. So you can't just pop your cold medicine out. You have to peel the foil back and then you have to pop it out. Those are unit dose packages, and they're considered child-proof. Okay, let's go on break again. Yes, ma'am.
And we were learning about, this is a different process, but in long-term care, you can order your prescriptions in packs.
Mm-hmm.
What is that called? They usually say they were in those forms of
We just call them med cards. They're just cards.
order.
But you're talking about where all of the drugs are packaged together for specific patients?
No, like the entire, like just ordered the whole in the form.
Are you talking about like at nursing homes, they have the blister packs with
Yeah.
all of those?
But when you order them, there's something different.
Off the top of my head, I can't remember. I know what you're talking about, but I can't remember the name of it off the top of my head. Okay. All right. So I'm going to go ahead. I'm going to pause recording while we go on break. Ta-da. Okay. Whoa, dude, what'd you just do? Okay. That's not what I really wanted. Okay, that's what I wanted. Okay, so the CSA, the Controlled Substances Act, this also happened in 1970. Remember, about an hour and a half ago, we talked about legends drugs and over-the-counter and behind-the-counter. Controlled substances are all legends drugs. They all have to be written with a prescription. However, not all legend drugs are controlled substances. Does that make sense? So all CSA drugs have to be written by a prescription, but not every drug that's written with a prescription falls under the Controlled Substance Act. So the Controlled Substance Act is what was meant to fight drug abuse. Of course, we've been fighting that fight for hundreds of years, right? And it rated the drugs, any controlled substances, anything that was potentially addictive, it rated them into different categories.
So all controlled substances are legend drugs, but not all prescriptions are legend.
No. All controlled substances are legend drugs and require a prescription. However, not all legend drugs are controlled substances.
Oh, not all legend drugs.
For example, albuterol requires a prescription, but it's not on the Controlled Substance Act. Make sense? Okay. So it classified drugs according to their abuse potential. Okay, we've got 5 categories. I talked about 4. 5 is really kind of, we don't see it very often. It still exists, but you don't see it a ton. They range from drugs with high potential for abuse all the way down to drugs with low potential for abuse. Narcotics are highly regulated and fall in the Controlled Substance Act. And we can reclassify drugs. So just because a drug is in one classification doesn't mean it's going to stay there. For example, we can have a drug classified as a class 2 drug, class 3 drug. And once it hits the market, we could go, oh, you know what? Maybe that's more abusive than we thought. Let's bump it up to a class 2. Okay. We can take a class 2 drug and bump it up to a class 1, which means it has no medicinal purpose whatsoever. I am sure there are examples of drugs being bounced down a class, but it's more likely that a drug is going to get bounced up a class than to come down. Okay. So class 1 or schedule 1, research only, not approved for human use, heroin, LSD, and of course we know marijuana, we've talked about that. Those are all schedule 1 drugs. Okay. Schedule 2, the dispensing is severely restricted. These drugs have to have a handwritten prescription and have to be hand carried to the pharmacy. We'll get into that more in other pharmacy classes, but these are not drugs that you can just give unlimited refills on, and you can't call these into the pharmacy by phone. There's a very small exception for that. So class 2 drugs would be like morphine, oxycodone, meperidine. Class 3 drugs have prescriptions that can be filled up to 5 times in 6 months. So this is what trips up a lot of people with refills. You have your initial fill and then 5 refills, which would give you 6 months. Okay. If we're not talking about controlled substances, things like birth control pills, this always throws people. We give them a year supply of birth control pills. It's only 11 refills because you have to take away the initial fill. Re means again, right? So they're not getting an again fill if they've never had their official fill. Okay, so it would be 1 fill and 11 refills for a whole year's worth of medication. Okay. So that's why Schedule 3 drugs, you can write up to 5 refills for 6 months. So things like codeine with aspirin, Tylenol 3, certain steroids, we can just write you a script, you can refill it. Okay. Schedule 4 drugs, we can still write a script and have 5 refills on. These would be things like benzodiazepines, and then Schedule 5 drugs. Now these are the drugs that I mentioned we don't talk about a lot. Some of them can be sold without a prescription and you have to be 18. So these would be things like cough syrup with codeine. The pharmacist can determine that you need cough syrup with codeine without you going to the physician. But do you see why we don't talk about or we don't discuss class 5s very often? Because we don't want people just going to the pharmacist instead of the doctor for their coughs. Okay. So a pharmacist could say, oh yeah, you've got this non-productive cough. Here's some cough syrup with codeine in it without ever going to the doctor and getting a prescription.
That's how it used to be.
Yeah, way back in the day. But we've moved away from that because now we want preventative stuff. If somebody has a cough, we want to know why they have a cough. Yes. Is that you?
Oh, can you reject? Can the pharmacist reject from getting
Yes, they can use their own discretion.
it? Does that mean they go into the cough or they just, like, what's their process to reject them?
Their liability. So they may just decide that they don't deal in class 5 drugs. They may just say, this is our policy. And it could be company policy. I don't know if Walgreens allows class 5 drugs. I don't know if they allow their pharmacists to do that. So I would say that while these are still on the books, you don't see it very often. You don't see them used very often.
So then it's just best to get a prescription for it.
So that would be an exempt narcotic. Cough syrups, the pharmacist can sell cough syrup with codeine without a prescription. So the farm tech can't say, yes, we're going to give this. It has to be the pharmacist, okay? The purchaser has to be 18 years old and have identification. And then we have to have this recorded. Name and address of the purchaser, drug name, quantity, date, time, and then the initial of the name and the initials of the pharmacist. Because we're not just going to be going out and giving out codeine with cough syrup, right? So yeah, they could do it. We just don't do it often. Okay. DEA registration, all physicians and pharmacies have to have a DEA registration. Pharmacy employees are not required to register, but the pharmacy must have a DEA registration. Does that make sense? So Walmart next door, their pharmacy has a DEA. Does this Walmart even have a pharmacy anymore?
I don't know.
It used to, when it was, this is the new old Walmart. But it used to.
The original Walmart.
Yeah, but I don't know that it does now. Anyway, we'll say Walgreens across the street, their company has the DEA number. But okay, yeah, it's just smaller than it used to be. Okay, the laws vary from state to state. So which law do we follow? The strictest law, yep. The DEA issues licenses to the medical practitioners. So this could be nurse practitioners, physician's assistants, MDs, medical doctors, and DOs, doctors of osteopathy, dentists, chiropractors to a limited extent. Okay. So the DEA gives a number to the medical practitioners and then to the pharmacies so that they can dispense them. And then the distributors, the wholesale distributors who distribute the medication to the pharmacies also have to be registered and licensed by the DEA. Okay. So the DEA can inspect medical facilities, including the pharmacies, and they track the narcotics from the manufacturer to the warehouse to the pharmacy. And with the CSA, that's a DEA form 222, which we'll get to. I hate that form. But there is a form that has to follow all of that. Any drug that falls under the Controlled Substance Act must be marked clearly with a C for category, and then Roman numerals. So C1, 2, 3, 4, 5, whatever. So on here, you can see that this is a class 2 drug. This is a class 3, and that's a class 5, I think. Can't really see it on here. Okay. For class 2 drugs or schedule 2 drugs, you have to keep records on file, separate records for all class 2 drugs for 7 years. So you have to have an entirely different filing system for class 2 drugs. All other drugs, class 3 and lower, and all of Legend drugs have their own filing system. Class 2 has to be by itself for 7 years. They have to be able to pull that up for 7 years. Schedule 2 drugs have to be kept separately in a locked container or in a cabinet that's secured to the floor so people can't come take it away. Okay. And then schedule 3 through 5 can be stored on the shelf with other prescription drugs. There used to be a thought that one of the ways to keep them safe was to mix them in with the other drugs, so that you would have to know to look for these, to know if you're getting narcotics. I think a lot of places now just keep them all locked up if they're a scheduled drug, just to be safe. So I already mentioned that class 2 drugs have to be handwritten, hand-signed by the prescriber and hand-carried to the pharmacy. We can't fax them over, we can't call them in without, I mean, there's one very small exemption for that. If the patient needs their class 2 drug and their doctor is out of town, this usually happens on weekends, of course, they can get an emergency supply of their drugs for up to 72 hours. But within that 72 hours, a handwritten script must be presented to the pharmacist. So if the doctor is off on a ski vacation and the patient runs out of whatever meds they're on, they can contact their doctor can contact the pharmacy, say give them an emergency fill. But within 72 hours, they better have a handwritten script at the pharmacy.
So I thought that's how it was supposed to be with like morphine and everything, but like at Kaiser, you go in one side of the building to see the doctor, and then you go to the other side of the building to go grab the pills. And I picked up my fentanyl patches and everything, like them calling it in next door.
Kaiser's its own critter. They have since they're in the same building, they have access to the handwritten ones.
Oh, okay.
Right. So it's not like you're going to a doctor in Windsor and trying to fill at Walgreens. You're literally walking across the building, and they will make sure that they have those class 2 drugs on file.
Okay.
They have them. They're just following it a bit differently than any other retail pharmacy would have to.
Okay.
So there is one exception for a 72-hour supply. Okay. The DEA form 222, I hate this form. Used to order class 1 and class 2 drugs. We don't order class 1 drugs. Okay. I suppose if we were an animal researcher, we might, but we're not going to. Has to be signed by a registered person. There are 3 copies to this: blue, green, and brown. So the blue copy is retained by the supplier. The green copy goes to the DEA, and then the brown copy is kept for your records. And the only reason I even know about the form 222 is that we used to keep Versed in our office, which is a conscious sedative. So we had to order our Versed from the pharmacy. And in order to do so, you had to fill out form 222. Has to be in a separate file from other invoices. It's a specific order form. You can't, every order form, because they want to track all the class 2, has its own serial number. I think we've got a copy of it. So if you screw this up, you have to, there's a specific way to avoid it, because it is, because it's got a serial number on it, and it's all chronological. So they have to be able to track every form. So this is what I would have to fill out to send to the pharmacy to order our drugs. And then the pharmacy would forward on the page that goes to the DEA. They would keep one copy on their file, and then we would keep one copy. What a nightmare.
Medical assistance. Fill this out? No.
I did fill it out, and then my doc would sign it with his DEA note. Well, considering his handwriting, it was better for me to fill it out than him. And then he signed it with his DEA number. And so no, I didn't have a DEA number, so I couldn't have ordered it myself. I was filling it out for him because, docs sometimes can't be bothered to fill out their own
So
paperwork.
if you have to have an actual prescription, how, like, sent to the doctor, then how the heck did that nurses or medical assistant, wherever she was, go in and call in all these narcotics and get them?
You just order a class 3 narcotic instead of a class 2.
Okay.
So the DEA numbers are assigned to prescribers for the controlled drugs. There's 2 letters and 7 digits. So the first letter is a code that tells us the type of registrant. The second letter is the initial of their last name. Okay. And then the 7th digit is what they call a checksum that we can calculate, and we'll go through this. Okay. Now, a lot of times we don't have to do this anymore because we put it into the computer and the computer runs to make sure that it's a legit DEA number. But if you, back in the day before we had EHR, we would have to check to make sure that the DEA number was correct. Okay. So this example will be AR, so the doctor's last name starts with an R. Just take the box. Okay. The doctor's last name starts with an R. So we add the first, third, and fifth number. So 4, 4, and 7, right? That's 15. Am I doing my math right? 4 plus 4 is 8 plus 7 is 15. Yeah, okay. And then we add the second, fourth, and sixth number. So 3, 2, and 9. So 3 and 2 is 5, and 9 is 14. And we multiply 14 by 2, and that gives us 28. Whew. So we add, what was my first number? 15, and we add 28. And that's what, 43, if I'm doing my math in my head right. Oh, look, I didn't have to do my math in my head. It's all right here. So what we're doing is then we look at the 7th digit. Remember that checksum digit? And 43, 3 matches there, so we know it's a legit number. Like I said, with EHR, it automatically, I mean, it's a very simple calculation for the computer to do. We just do 1, 3, 5, 2, 4, 6, multiply that, add them together, bam. Check to make sure that the last number is the same as the last number of what we added up. The DEA number for controlled substances has to appear on the form, along with the patient's full name, street address, all of that stuff. We know there's no refills on Schedule II drugs. When filling the script, pharmacists will draw a line through it so that we know that it's been filled. I mean, and that's pretty simple to do. For a controlled substance, we have to have the patient's full name and address, the practitioner's name, address, and DEA number, which is usually pre-printed on the prescription pad, although we don't see prescription pads very often anymore. They get printed off the EHR and then the doc signs it. The drug name, strength, dosage form, quantity, directions, and refills, which is what we need on all, not just CSAs, but we need that on all drugs, right? We need to know what to give, which form to give it in, how much to give. We need all of that. It should be written in ink or typewritten and signed by the physician, or the prescriber. So for class 2 drugs, you can print it out using your HSA, not your HSA, that's not your health savings account, your EHR, your electronic health records. They can put the prescription into the computer and print it out, but it still has to be signed by the physician by hand. It can't be an electronic signature. And then the controlled substance has to be dated on the date of issuance, meaning when you give them their drugs, there needs to be a date on there so we know when it was given. Okay. Schedules 3, 4, and 5, and can be verbal, written, or fax, can be refilled up to 5 times within 6 months. Schedule 5 can be refilled as directed by the prescriber. So if the doc does prescribe, if the doctor prescribes the cough medicine with codeine, they can say refill for a year. It's up to the doc. Okay. Schedule 2 requires a written prescription by the prescriber that is signed, and we know that Schedule 2s do not get refills. I've beat that horse to death, right? Okay. The Drug Listing Act of 1972 gives the FDA the right to compile a list of medications. This is where we get the NDC, the National Drug Code. Okay, it's 10 characters that tell us the manufacturer, distributor, the drug formulation, and the type of packaging. The FDA does not require that the NDC appear on all drug labels, but they mostly do. It's not required, it's just requested. It's easy enough. If the NDC is there, it's easy enough to print it on the drug label. So the NDC number has 3 sets of numbers. The first 5 numbers are the manufacturer, so each manufacturer has their own unique number. The second 4 digits are the medication strength and dosage form. And then the last 2 digits tell us the package size. And of course, this is all encoded. They came up with it, so it means something to them. Federal laws also require that containers not look like another drug, but some drugs do look alike and sound alike. So you really need to always double check the drugs you're giving, okay? Check the NDC number against the NDC on the prescription label. Just always, always, always read your labels, okay? You guys haven't had drug admin yet, right? No, okay. So I just wanted to make sure at the beginning of this whole pharmacy series. One of the things we talked about are the 3 befores in drug administration. You check the label before you remove it from the shelf. You check the label before you prepare it, draw it up, or do whatever. And you check the label again before you give it to the patient. Okay, you have to check it multiple times because there are drugs that look alike and sound alike. Dennis Quaid has twins, and they were almost killed by a nurse who grabbed a bottle of, oh, what was the drug? I don't know, it was an anticoagulant, I believe, and inadvertently gave them the adult dose instead of the infant's dose because she did not read the label. And then she still didn't take ownership of it. What she said was, well, the manufacturer shouldn't have, because of this, the container shouldn't be looking alike. The label shouldn't look like the pediatric dose. It's still her responsibility as the person actually administering the drug to read the freaking label, right? Read the label. It's not that hard. An orphan drug is intended for use in very few patients with a rare disease or condition. So it's a disease or condition that affects less than 200,000 people in the United States. You know how rare that has to be? I mean, how many millions of people live in the US? Right? So because the market is so small, developing the drug would be super expensive and you'd never recoup your money, right? So the Orphan Drug Act encourages the development of orphan drugs by giving tax incentives to do it, okay? And then giving the manufacturers exclusive license, meaning that if you come up with a drug that is for the specific set of people that of the entire U.S. population, there are less than 200,000 people with this disease, nobody else can make that drug. So you're the only one that makes money off of that drug. Okay. Because if they didn't have these incentives, 200,000 people with the number of people in the US is a drop in the bucket. No pharmaceutical company would take that on because they'd just be losing money, right? So the government gives them tax incentives and the exclusive licensing. Cystic fibrosis is one that has orphan drugs. But there are currently 350 orphan drugs on the market. So there are 350 drugs that have such a small market that they're never going to make any money off of. Okay, so the Price Competition and Patent Term Restoration Act. This allows the drug manufacturer, or it allows drug companies to manufacture generic versions of drugs. Okay. Once the original patent expires, any manufacturer can offer a generic version of that drug. Okay. So when Advil's patent expired, everybody could make ibuprofen. When Tylenol's patent expired, everybody could make acetaminophen. Okay. It's usually less costly than the brand name. Why? Why is generic cheaper than brand?
They probably found different chemicals or items to use that are cheaper, or everything's already done, so they can just.
Everything's already done. The research and development, all of the expensive stuff, the NDA, all of that is already done. All they have to do is take the chemical structure, and if you guys look in here, flip it open, it doesn't matter. You'll see,
This is theft stuff.
but it's legal theft. So let me find her, come on. There should be, okay. This right here, that is a blueprint. Any good pharmacist, and I am not a good pharmacist, but any good pharmacist can look at that and build that exact molecule. Okay. And then if you read the chemical description of it, it'll say something like 1,4, blah, 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 blah. So, the chemical name for sumatriptan is 3-12-hyphen-dimethylamino N-hyphen-ethyl-N-methyl-5-methyl-sulfonamide succinate. Even if they don't have the drawing with that chemical name, they can build that drug. So like the N's and the R's tell you which way the light bends when it refracts off of each of these. It's crazy. So yeah, that's why the generic is cheaper, is because the people who owned the patent had to put all the money into coming up with this. And now the generic drug companies go, hey, thank you for that, and build their own. Isn't it incredible? So yes, it's legal theft.
If they wanted to, like, tweak it a little bit, would they have to start over?
Yes. So generic has to be the exact same chemical composition, okay, of the active ingredient. That's important. Has to be the active ingredient. The inactive ingredients, the fillers, the things that make the pills, can be made of anything else. So there are some people who will say, I can only use the brand's name. And they're not being snotty. It's that they've tried the generic for the most part, and they had a bad reaction to whatever the inactive ingredient is. The active ingredient has to be the same. However they choose to carry that active ingredient can be different.
But sometimes it seems like the generic don't work as good as the brand name.
And I can almost guarantee that's inactive ingredient stuff. The active ingredient has to, by law, be exactly the same. Exactly. There are some, so for example, my daughter is allergic to the carrier because she had a pink eye. And we thought it was the antibiotic she was allergic to. It wasn't. It was whatever base ointment they put the antibiotic in. So she had pink eye, and I put her little, have you guys ever had pink eye? Okay, so pink eye, you put that little ribbon of crap in their eyes, and then she had instant hives and swelled up. We could give her the oral form of that antibiotic, but she couldn't have the ophthalmic form because the carrier is what she had a reaction to, not the drug. So the active ingredient has to be the same, but the inactive ingredient does not, which I would bet is why people do better or worse with generics. Some people do better with them or do just fine, and some people don't at all. So, a drug has several names. The official name is the generic name. Okay, it doesn't matter what the brand name is. If you read any medical literature in any medical journal, they will always refer to the drug by the generic name. Okay? And that's supposed to give some impartiality. So
like
they're not
naproxen sodium.
right. So they, as they write it up, unless it's an advertisement, it should always be referred to as naproxen sodium. Okay. So that it doesn't appear they're granting favor to one pharmaceutical house over another. Does that make sense? So this is their official name.
Why would you do that? Because the manufacturer is the one who made it, so it shouldn't be called the brand name?
The patent's going to be up eventually, so no. It's always the official generic name. They may say, like when Viagra first came on the market, they'll say, you know, the brand name is this, and then the rest of the paper would have been sildenafil. There can be one or more brand or trade names. With Celebrex and Vioxx, those hit the market from 2 different companies within weeks of each other. Okay, they were both COX-2 inhibitors. They both had the same mechanism of action. They were both essentially the same drug with from 2 different companies. So you can have different brand names from different manufacturers, but we always talk about the generic name. The generic name is the most important one. And then the chemical name is that one that I read out with all of the parentheses and dashes and ends and numbers and all of that stuff. That's the chemical name, and that's the blueprint. Any chemist worth their weight can build a drug based on that blueprint. Which is why, and now I've never seen one episode of Breaking Bad, but my understanding is Walter White was a chemistry teacher or a science teacher and started making his drugs because he understood how the chemicals work and could build it that way. Isn't that crazy? Generic drugs are pharmaceutically equivalent. I talked about that. The active ingredient has to be identical. Okay. The active ingredient has to be the same, the dosage form has to be similar, and the route of administration and strength need to be the same. So therapeutically equivalent means the body uses the drug the same way as it would use the brand name, okay? So we look at things like bioavailability and stuff like that that we'll talk about in other pharmacy classes. The Prescription Drug Marketing Act of 1987 prohibits that prescription drugs manufactured in the U.S. and exported cannot be re-imported other than by the product's manufacturer. So if Pfizer builds a drug here in the U.S., sends it to England, and a third party wants to send it back to the U.S., they cannot do that. Pfizer has to bring it back to the U.S. Okay, that's just
Why is that?
avoids any third-party selling of drugs. Okay. Prohibits the sale or trading of drug samples. We can give you drug samples, but we cannot sell you drug samples. Okay. Prohibits the distribution of samples in response to prescription drug samples being illegally diverted and distributed to persons other than those licensed to prescribe them. Meaning, if you're not licensed to give out samples of Viagra, if you're not a doctor, you can't go giving people Viagra. Right? Does that make sense?
Yeah. Yeah, that's one of the reasons why they took out, we used to have a little medication vending machine at work, they had Tylenol and Alka-Seltzer and all that stuff.
Mhm.
And they said it was a liability, they didn't have to.
Right. A lot of people have taken stuff like that out because of that. OBRA requires states to establish standards for drug use review. That sounds a lot like the billing classes, huh? When we're talking about medical use review and drug prospective reviews and stuff. That all falls under OBRA. Okay. This requires pharmacists to offer counseling to Medicaid patients. Now, should pharmacists offer counseling to everybody? Sure. Yeah. If you have a question about your drug, the pharmacist should offer, but it is required by federal law that if you are on Medicaid, you have to have a pharmacy consult.
Is that because Medicaid wants all their people to understand what they're taking, or?
Yes. So this is why it makes sense for pharmacists to do this with every patient. A lot of times they will do it with a drug that you've gotten the first time, if you're not a Medicaid patient. If you are prescribed a drug that you've never had before, pharmacists will then say, or the pharm tech will say, do you want to talk to the pharmacist about this? Do you have any questions? Which is great, but they are required to counsel Medicaid patients. Okay. And then OBRA requires that manufacturers rebate to state Medicaid program the difference between the manufacturer's best price and the average billed price, so that the pharmacy's not losing a ton of money. HIPAA. Do we have to go over HIPAA?
No.
We know HIPAA, right? Okay. Excuse me. Thank you. Yeah, pay attention to what you're doing with HIPAA. Don't talk to people about patient specifics. Fair enough? Okay. You know, if you get fired for a HIPAA violation, it's almost impossible to get hired anywhere else. So HIPAA violations can ruin your career, in addition to, you know, all of the civil and criminal sanctions that go along with it. Okay. For pharmacy, HIPAA requirements include restrictions of transmission of prescription data. You have to have a private area for counseling, and then a training program. Does this seem logical? Yeah. Okay. We know what PHI is, right? Protected health information, which would be name, addresses, identifying numbers, pictures, dates, any of that. Those are all protected health information. We don't talk about it. Okay. MedWatch is a program that allows any healthcare professional to report an adverse event. Okay, so this is all part of that post-market survey business. So if there's a product problem or a medication error, then it should be reported to MedWatch. It's completely a voluntary program, but it's super helpful. So the reason we have MedWatch is to detect the side effects that we didn't see in the clinical studies. Things like osteoporosis from Depo-Provera. Clinical studies weren't going to show that because they weren't going to run those clinical studies for 20 years. But now we have a whole bunch of women who've been on Depo for an extended period of time, and they've got either osteopenia or osteoporosis. That needs to be reported to MedWatch. Okay. If an adverse drug reaction is reported, then the manufacturers have to file a report. And a lot of people, you know, there's so many people out there who think the government's out to get them. Really, we are safer than we've ever been with medications. All we have to do is dial back the clock to the 1920s before we started killing all those kids with antifreeze, right? Just because we have this number doesn't mean that the government's trying to poison you. It's to help protect us so that we know things like, oh, maybe you shouldn't be on Depo for more than 10 years because your risk of osteoporosis is higher. Or, oh, maybe you shouldn't take Ambien every night for months at a time. You know, things like that. So it's not an admission of guilt. This is part of the post-market survey. We cannot know about the side effects unless people tell us about the side effects. We don't know. When you're doing your trials and you've got 3,000 people, that's less than 1% of the entire US. So if we have more people on, are on it, the more potential we have to identify side effects. So those liability attorneys on TV who want you to get on the class action lawsuit, that's not an admission of guilt, that's data gathering. Okay, it's usually the anti-vaxxers who get all upset on the VAERS system. Well, if vaccines were 100% safe, we wouldn't have to have the vaccine adverse reaction. They're safe. That's all I can say.
So like the people that get the vaccines and they have the allergic reactions, that's just something that is carrying that vaccine, or like that main ingredient.
Yeah, usually it's the carrier that they have. So I had a student who cannot get the flu shot because the flu virus is replicated in chicken eggs, and she's allergic to chicken. So she could get the flu shot. They actually do make a flu shot that is not replicated in chicken eggs, but it's like $300 per shot. She's like, I'd rather get the disease than pay that. She's young and healthy. I won't get the flu shot.
So what about the people who say that they get sick when they get the flu shot? Are they actually just having an adverse reaction to something else, or is it all in their head?
So, no, they actually do get sick, but it's not from the vaccine. What people don't understand is that there's the incubation period. And so everybody who says, oh, I got the flu shot and it made me sick. No, it didn't. You were exposed to the flu either 2 weeks before you got the shot, because of the incubation period, or 2 weeks after the shot. The shot is not immediate protection. So if you remember from Med 102, we have to expose the body to the disease, and then the body has to build the antibodies. That takes about 2 weeks. So there's actually a month window around your vaccine where you could be exposed and pick it up. So 2 weeks before you got the shot to 2 weeks after you get the shot, you're vulnerable. What usually happens is that somebody near them gets the flu, and they go, oh crap, I need to go get my flu shot. And they go get their flu shot, and now they've got the flu, and they associate it with the shot instead of the fact that your child with influenza A coughed in your face. So having said that, flu killed vaccine. The flu injection cannot give you the flu. The flu mist that goes up your nose can give somebody who is immunocompromised the flu, okay? Because the flu mist is a live virus, but it's weakened. It's called live attenuated.
Didn't they make that where they don't do that no more?
Well, you can still request it, but you have to not be around anybody with HIV, who's had transplant, who's immunosuppressed, who's on it, because you could potentially spread it to somebody and kill them. I mean, I would feel horrible if I killed my friend's daughter who had a heart transplant because I didn't get my shot. I did the live vaccine. We have very few live vaccines. But like I said, the anti-vax people really, they take this as an admission of guilt. If vaccines were 100% safe, and not a single person has ever said vaccines are 100% safe. There's not a vaccine on the market that is 100% safe. We know that. We admit that, right? But if there is an adverse event, something that they didn't recognize, then you have to report it. Okay? And then there's an online form that you fill out. And most of the time, most of what gets reported is a patient who got their injection and then the area around the site gets red and hot. Well, that's a normal, it's a normal inflammatory reaction to getting stabbed with a sharpened piece of steel. It's that if it goes beyond that, that we have issues, and that should be reported. So, of course, we tell our parents after we give kids shots, if there's anything unusual, you need to let us know. Come back in. And then the doc will determine whether it's truly an adverse reaction or a normal reaction. Because it's perfectly normal for kids to be sore and cranky for 24 to 48 hours after a shot. That's perfectly normal. But if the site develops an infection, that may not be from the vaccine, that could be because the MA had lousy technique and didn't clean the site well, or something along those lines. So it really does, if a parent is afraid of an adverse reaction, the child needs to actually be seen and the doctor determine whether it's adverse reaction or not. So there's the FDA Center for Drug Evaluation and Research, gives us drug-specific information, including FDA alerts. It works with the drug manufacturers to develop risk management programs. Okay, so we have alerts like the iPledge program for Accutane. I mentioned earlier that Accutane is an exceptionally dangerous drug, right? It's really, it's hepatotoxic. So if a healthcare professional is going to prescribe Accutane, they have to register with iPledge so that they get the training to prescribe this safely. We had one physician in our practice who could prescribe Accutane, and when he went on vacation, nobody else could refill it. So he just made sure that if any of his patients were coming due for their Accutane, that they came in before he went on vacation so he could do their blood work. So you always have to have liver function tests done for that.
That can get expensive.
It's very expensive. And Accutane is used for cystic acne. And you know, cystic acne is you've seen people with it. Big, huge cysts all over their face. It will leave lots of deep cratering scars. And it's excellent for that. Where I had issues as an MA was when parents would come in and they'd want to start their kids on it before prom so they wouldn't get acne. A zit on prom is not a big deal. It really should only be used for deep cystic acne. And so we had to do a lot of parent education that, you know, we're not going to give your kid this because a zit, or even a bad breakout before prom is not going to scar your child for life. Whereas with deep cystic acne, now you might look at child's face scarred for life versus the liver issue. But there for a while.
As you, okay, do you want a perfect prom picture or do you want a healthy liver?
Right, right. And so there was a lot of parent education that went on when Accutane first came out because of that, because they'd hear about this miracle drug. Well, remember when Retin-A hit the market? You might be too young. Retin-A was, they still sell it. You still see the celebrities on TV talk about it, but it's really a chemical peel for your face. And it makes your face so much worse before it gets better. So it looks like their face gets really red and raw and chafed, and it looks so painful. My brother actually used Retin-A for a while until he decided his face looked worse with the Retin-A treatment than it did with the zits. But I can't remember what it's being marketed under now, but you see it on late night TV shows with all of the celebrities.
Is it that now named
Proactive.
proactive?
Yeah, that's a version of that. So, yeah, their face looks terrible while they're on it. It's basically a chemical peel. And then it looks great. My other thought is,
After the
If-
facelift and liposuction.
well, my other thought is that if they didn't wear so much makeup for so long during the day, I mean, and I know that's their job, but I feel like their faces would be in much better, their skin would be in much better health. That's, my opinion, not science fact. All right, so let's go on break. And then when we come back, I will put you guys together and you'll work on the, let me find the group project. Since there's two of you, you get to do the group project together. Oh, I timed out. Anyway, so go ahead and go on break, and when we come back, we'll work on that. Okay, and then on Thursday, we'll do mathy stuff. Thursdays will be our math day.
Good, because I have lots of questions.
Okay, all right. And Glynis, I'm going to go ahead and stop recording now. I'll get this uploaded and I'll send you the link. So do not forget to do the group project that's not a group project for you. Let me just log in here and get you the name of that. Please bring that, please submit it before class on Thursday. So this is the one that I want you to do, Glynis, the medicine cabinet danger worksheet. You will want to do, at first you will do it, you'll answer the first column just with your general knowledge. Don't look anything up, just tell me what you think, okay, in the first column, and I'll show you here in a second as soon as it opens. So here, you just guess the answer, okay? So these pink rows, don't worry about, but guess the answer here. And then after you've guessed all the answers, then look it up and circle whether you got it right with your guess. And if you did not get it right, then put the correct answer over here. And there's, I think, 3 pages of that. So you can download this, print it, or you can download it and then type in your answers and then submit it to me through the Dropbox before class on Thursday. All right. Thanks for letting me know you couldn't make it in and requesting the Zoom session, and I will see you Thursday. All right. Have a good afternoon.